Hey, Long Beach, thank you again for joining us. We're here for another update, of course, on COVID-19 within our city and to talk about some of what is happening in the state and across the region as well. I'm Mayor Robert Garcia, and of course, we have joined with us today Dr. Davis, who heads our health department, and we have Alice, who will be doing our Spanish translation at the end of the briefing, as well as Paola, who is doing our ASL translation as well. Today, this is the April 15th update. And again, we do these updates every Monday, Wednesday, and Friday. I want to just start off with several updates as it relates to the latest numbers for the city. We now have 379 Long Beach residents who have tested positive for COVID-19. We know that number is a number that increases every single day. And we know that number continuously goes up as well. And so we are grateful that our hospitals and our folks within the medical community are really doing a great job of getting that information out to folks and making sure that people are aware of the risks that we have out there. We know that we also have our death rate that continues to increase. So we now are at 18 deaths across the city. Those 18, unfortunately, we can expect more of that as well to happen with hospitalizations that we have currently in our hospitals. And since our last update, that number increased by 4. We, like always, are thinking about the families, those that are affected, the friends. Our love, our prayers go out to everybody. And I think all of us are beginning to interact and know more people that either have tested positive or unfortunately that have passed away. I know I've seen that, whether it's on social media or through friends or through family. And so we are all being affected and know people that are being impacted through this health crisis and pandemic. I will also share that we have had our first individual from our population of folks that are experiencing homelessness also test positive for COVID-19. I think that result came in just today. So it's the first person that was experiencing homelessness. I believe that person is hospitalized right now. Dr. Davis might know more information on that, but that is something that we take very seriously. Of course, we have 4 shelters across the city for people experiencing homelessness, which we are doing physical distancing, and we are working hard to ensure that that we are keeping people safe. But we will have more information on that in the days ahead. I want to share that we also, as people are aware, put out information on race and ethnicity earlier this week. We will continue to put that information out every few days so that there are updates on how we're doing. We have created an all-new dashboard and website for COVID-19. That should be launching here in the next few days. That'll give you a lot more data and information from the city site for people to access as we move forward. I also want to share that and thank the LA County again for partnering with us on our testing site. People are signing up every single day to go through our drive-through testing site at Long Beach City College in the Pacific Coast campus there in the center of the city. You can also continue to get tested by reaching out to your physician. Our hospitals are authorizing tests, and our health department is also doing testing, especially for first responders by appointment only. And so please, you can visit the longbeach.gov COVID-19 page. There is a testing link, and you can click that link and find out and get screened online for testing. We have been discussing how we increase testing in the days ahead. We will have some announcements on Friday as to some new testing sites in Long Beach. We have already, and our management team has already expressed to the city and to the council and myself that one of our key indicators of where we will be placing those sites is going to be in relationship to ensuring that our communities that are being most affected have direct access. And in the case of Long Beach, we know that our African-American population, our Black community is being disproportionately affected as it relates to hospitalizations, which is what we put out a few days ago. And so you can expect that our testing strategy will, as we grow, will ensure that we are providing that level of support for those communities so that they have easier access to testing as well. And so all of that is being worked on, but of course we will be continuing to provide testing for the whole city. I want to now transition to some news that the governor discussed yesterday. We are constantly talking about how we eventually reopen the economy. Reopening the economy will be as difficult as to the process of how we began shutting down businesses and implementing these health orders and our safer at home policies. It's going to be as difficult, if not more difficult in some cases, when we begin to reopen. Yesterday, the governor put out a series of principles, a framework of how this process begins. I will add a few things to that. The first is, please know that in Long Beach, we have our own health department. We're a city of 500,000 folks. We're roughly the same size as Atlanta, Georgia. This is a big, huge city. And in California, we have large cities. And so for a city our size, we make our own decisions as they relate to our health order. And our health department, led by our health director and, of course, Dr. Davis, are really the ones making the medical calls and working with all of our partners at the CDC and the state and the county. So what's next as we transition to this part of our response? First, know that our top priority remains the health and medical crisis that we're in. So while we're beginning to have conversations about the reopening of the economy, our focus must be on ensuring that we keep people safe, that our hospitals have what they need, that we have the ventilators, that there's capacity in our hospital system, that people have the PPEs, and that folks are safe. That is truly the priority right now, especially as we continue to see more deaths, more positive cases, and in California, well, we're beginning to possibly see some flattening of that curve. We just don't have enough data to be able to definitively say that we are past the crisis part of our medical emergency. We have a ways to go there. So please know, priority number one is this medical piece, is this hospital piece. As we're focused on that, the governor laid out 6 broad conditions of how we begin to think about the reopening of the economy. He talked about being able to closely monitor and track potential cases, especially as it regards to testing. That's going to be critical. We discussed the preparation of hospitals, the infection risk of high-risk individuals, ensuring that schools and businesses are doing physical distancing. And I would encourage folks to read the governor's framework and plan. What he's really talking about is a regional approach paired up with our sister states in Washington and Oregon and in California to come up with a series of guidelines as we reopen. And he mentioned, which I think he's right, how we reopen businesses is going to be important. Does it mean that folks will have to be screened as they come into a business? Does it mean that if you're at a restaurant, your waiter might be wearing a face covering, have gloves, and folks will be spaced apart? How do we reopen other essential types of businesses? So those are the questions that have not been answered. But what we do know is that those questions are now being discussed and are on the table. We know that there's a lot of folks out there that are unemployed, that need support, and small businesses that are hurting and in many cases won't reopen. And so we want to begin this discussion as soon as possible and begin having conversations about what happens once we get past this safe at home order and we begin reintegrating folks back into the economy. So you're going to hear in the days and weeks ahead more conversations about what this framework would actually look like locally. As you're probably aware, when the state began putting its guidance out for cities and counties, different counties and cities took different approaches. And while one approach may have worked in the Bay Area, LA County, Long Beach, Los Angeles took a slightly different approach. And so while there is some general alignment, different cities and different counties and health departments are taking slightly different approaches, and then we're seeing what works, what's working better in what jurisdiction, and then aligning ourselves to learn from each other so that we have the best health system and the best response possible. And I imagine that that's how we're going to also reintegrate back into this kind of reopening as we move forward in the weeks ahead. And so in anticipation of that, one thing that I will be doing is we will be forming an advisory group of business leaders, of those in the workforce, of commissioners within the city from our Economic Development Commission and others, leaders within our business organizations in the city. And we'll be putting together an advisory group that will then serve to start putting these ideas together to really present to us as a city how we take a Long Beach approach to getting our economy moving again. I've also happy to report that I've asked former Mayor Bob Foster, who not only served our city during a time of very difficult economic recession, but was also the CEO of a very large business before he became mayor and knows the business community well. I've asked Mayor Foster to help lead this conversation within the business community so that we have the best ideas and the best conversation around what's the right way to do this, with always maintaining that at the center of those discussions will first and foremost be the health of the public. We will not sacrifice the health of the community for jumping too soon on the economic recovery piece, which we know is critical. But we know that's important and we need to do both. And so I want to thank Mayor Foster for agreeing to serve in that role. And we will have more information on how this advisory group begins to do its work in the days ahead. We will also be announcing, and Dr. Davis will be getting into details about a new health order we have that we're putting in place to protect older adults. We know that half of our cases as they relate to those that have passed have been individuals at our nursing and skilled care facilities. And so addressing that is going to be really critical, and Dr. Davis is going to do that. And I want to mention that last night, I want to thank the Long Beach City Council, who last night spent a significant amount of time adopting and passing a big set of reforms and actions that are going to help as part of our broader economic relief plan. So what did the City Council do just last night? The first thing they did was they filled in the gaps for federal sick leave. And so Congress passed a plan to ensure that folks had sick leave, all folks had sick leave for larger corporations of over 500 employees. That left a lot of folks in Long Beach out. And so the Long Beach City Council came in and passed a policy to cover workers for businesses under that 500 limit. And so this will help thousands and thousands of workers across our city to get paid sick leave through their business or their company and help themselves as it relates to COVID-19. They passed measures to help our hotels and our motels to create a hospitality recovery task force that will develop strategies to bring back tourism and travel. They put in plan a program to look at assisting mortgage holders and how we partner with nonprofits and the federal government to help those that have mortgages that we know are going to also have a hard time, and developing a mortgage assistance program. We put in places to help frontline individuals like our hospitality and janitorial workers, and having a policy in place to retain and those workers, even those that are laid off, so they can come back to work when the crisis is over. And we've established new health protections for grocery workers and other small businesses. Now, these are just some of the policies that got put in place by the City Council last night, and I want to thank all of them for their work, and I look forward to signing all those policies into law. Finally, let me just say that our health department is doing a really fantastic job of meeting this crisis. We're constantly communicating with our hospitals and do so on a regular basis, and we are feeling prepared for the weeks ahead, even though they will be difficult. And so with that, I want to turn this over to Dr. Davis to give us a broader overview of the new health order that we have in place. Dr. Davis.
Thank you, Mayor. So as he mentioned, I'm going to go over our work with older adults and long-term care facilities. The data shows us that older adults, as well as those with underlying health conditions, are at higher risk for developing serious complications of COVID-19. This is consistent with what we've been seeing nationally and statewide. We've been working closely with long-term care facilities over many years to assist, educate about, and implement proper protocols to prevent infection among older adults. During this pandemic, the Health Department's Communicable Disease Control Program has been communicating regularly with the city's numerous long-term care facilities and assisted living facilities, and working in partnership with the California Department of Public Health's infection preventionists to share best practices that support older adults in Long Beach. The Health Department has also been making personal protective equipment available to facilities to ensure that they have enough. We're also prioritizing laboratory testing for both residents and staff, and updating the city's website to ensure that long-term care facilities receive up-to-date guidance from local, state, and federal authorities. As the mayor mentioned, we're issuing a new order designed to protect older adults and those with underlying health conditions who live in long-term care facilities. This order brings together the best practice recommendations of the Center for Disease Control and Prevention, the California Department of Public Health, and the Centers for Medicare and Medicaid Services. This new order outlines requirements that facilities need to have in place to keep residents and staff safe. So I'll just kind of provide a brief summary of some of the recommendations included in this order. One of the requirements focuses on limited entry. While residents at these facilities will be able to have virtual visitations, all in-person visits will be prohibited while the order is in place, including visits by volunteers and non-essential workers. By reducing the number of people who enter a facility, we reduce the likelihood of those inside the facility being exposed to the virus. So only employees, first responders, medical professionals, and contracted essential maintenance workers or service providers will be able to enter. There are some exceptions, for instance, at end-of-life times. A second requirement is focused on screening for these groups. Staff and other essential personnel will need to have a symptom screen and have their temperature taken before entering the facility. Anyone with a fever or symptoms of a respiratory illness will not be allowed to enter. An additional requirement involves face coverings. All staff will be required to wear a surgical mask at all times, and residents will have to wear a surgical mask or a cloth face covering when outside of their room. The goal of the order is to protect the medically fragile and older individuals in congregate settings. So in addition to long-term care facilities, the new order applies to a number of other sites, including adult residential care facilities, chronic dialysis clinics, hospice facilities, continuing care retirement communities, intermediate care facilities, psychiatric health facilities, residential care facilities for the elderly and for the chronically ill, and social rehabilitation facilities. This new order will become effective today, April 15th, 2020, until further notice. Just as we believe we flattened the curve in the larger community with the Safer at Home order, it's our belief that we can slow the spread of COVID-19 at long-term care facilities as well. Again, this is vital with those who are developing severe, life-threatening symptoms, which is the case for many of the residents at long-term care facilities. Finally, for all the latest information and updates, please continue to check our website, www.longbeach.gov/COVID-19. You can also follow us at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you, Dr. Davis. We're going to take questions from the press now, and then after that, we will do a summary in Spanish. So I'll turn this over to Jake.
Thank you very much, Mr. Mayor. The first question comes from Rachel Jordan from ABC 7.
Can you hear me?
Yes.
Okay, so this question is for the mayor. So I've spoken with residents and business owners in our city who have seen an increase in homeless people gathering and camping in their specific neighborhoods. So aside from adding more homeless shelters and hand washing stations, what else is the city doing to keep everyone safe, those housed and unhoused, and enforcing physical distancing?
So first, I'll just note that while we have now 4 shelters that are open, thank you for the question, we have about 60% capacity that are within these shelters approximately, and then those go up and down. But there is capacity in the shelters that we have opened for more individuals experiencing homelessness. So they're not full by any means. At the same time, we know that we can't right now necessarily force someone into shelter, especially if they're healthy, and so we are also trying to figure out the best way to get folks to distance. Now, we understand that a few things are happening. One is Long Beach had a homelessness crisis before COVID-19, and we're still in a homelessness crisis, and that has not gone away. And in fact, this issue is exacerbating our challenge, not just here in Long Beach, but across the state of California and quite frankly, the country. And so we have our outreach teams out there. We are first and foremost making sure that there is safety precautions in place, which is why we've put out additional washing stations, why we've launched the safe parking program for folks that are in automobiles. We've partnered with churches. We've opened up facilities like at Silverado Park and at Martin Luther King Park that have shower facilities so that folks get access to those facilities. So we are doing a lot, but a lot more is needed. We are very aware of that. We have partnered with some hotels and motels and are looking at putting in a partnership to get folks into some of these places. But please know that for the last few weeks, our public safety resources have been stretched really thin, as have our health and homelessness services resources. And so we are now beginning to go back and also trying to get back to doing some of the work that was difficult to do in the last few weeks as it relates to homeless outreach, because we were dealing with a huge crisis in front of us. And so you're going to be seeing more of our HEART teams out there, which was our specialized unit with the fire department, more of our quality of life officers, which are police officers who are trained specifically to assist people experiencing homelessness. Some of that work that had, quite frankly, shifted to the emergency will begin to shift back into the regular work, and we're going to try to get folks into shelters. Obviously, no one should be gathering outside, whether they're homeless or whether they're a family, and so we will continue to try to enforce that as best we can. I would encourage businesses and or individuals, if there are folks that are not that are being unsafe and they're gathered in groups, regardless of who they are, we should, if it's a recurrence, then we should know that, and they should contact the health department or one of the non-emergency lines through our dispatch to get folks out there. And so we are trying our best. We know it's a challenge, and I've seen it as well. And so we're working on that.
Thank you, Mayor. The next question is from Jeremiah from the Long Beach Post.
Hi guys, can you hear me?
Yes.
My question is about homelessness too. I just am curious if you can give us any more details on the circumstances of this first positive case, even just basics, age, sex. Was this person in a shelter? Was this person out on the street? Was this discovered when the person came into the hospital, or did they come in with symptoms hoping to be tested? And where are you at with tracing this person's contacts? Because I could see that being very challenging if this is someone who was living in an encampment or unsheltered.
So I'm going to turn this over to Dr. Davis, but this just happened. So I'm not sure we have much information, to be honest. Dr. Davis?
So I can say that he is a male. He's hospitalized in stable condition, and the investigation is ongoing, and we should have more information. What we've heard so far has been reassuring as far as exposures to other places in the city.
All right, thank you very much, Dr. Davis. The next question will be going to Haley at the Press Telegram.
Hi, my question is about the new health order. Can you just share a little bit more information about how it will be enforced?
How it will be enforced? Thank you for the question. So I think it's really important to work with our partners. We all have the same goal, which is to keep our residents and our staff of all of Long Beach, including in our institutions, as healthy and as safe as possible. And so this really just provides a framework for all of us being on the same page and having something that we're pointing to, because there's numerous best practices coming from different organizations. So now there's one uniform guide that we all have agreed is very important in order to prevent the spread and to keep COVID out of our facilities. So we'll really be focusing on partnering and working together.
Thank you very much, Dr. Davis. The next question again comes from the Long Beach Post, Kelly.
Yes, hi. This question is for Dr. Davis as well regarding nursing homes. I saw yesterday that Royal Care Skilled Nursing Center in Long Beach had put out a statement saying it has 2 confirmed coronavirus cases, but the city hasn't yet included that in its list of facilities, nursing skilled long-term facilities with coronavirus. Could you talk a little bit about the process of how the city confirms cases in its nursing homes and maybe if there's a timing lag there?
So there, where the lag comes in is when we post it on the website. So what we like to do is to give the nursing home an opportunity to inform their staff, their residents, and their family members. And so that can take up to 2 days. A lot of times they're using regular mail. And then once we know that that has been done, then we will post it on the website. So you should be seeing that really soon.
And I think, Jake, I also see on the list I have here, there's a question from Colby Burnell. I don't know if
Yes, Colby is online right now. Colby will be asking the next question from Politico.
All right, Colby.
Yes, hey there. Thank you so much for taking the time. 2 quick questions, if I may. Just want to follow up on some of my colleagues' questions about homelessness. Does the city expect a surge in homelessness cases? And then also on a different subject, on the opening of businesses, Governor Newsom said yesterday that the local control of this is going to be very determinative of how that rolls out. And has the city started thinking about guidelines and timelines for reopen businesses? And if yes, what is that thinking so far?
Well, let me take a crack at both, and if Dr. Davis wants to add, let me just start by saying that the homelessness question is top of mind. So we're discussing that constantly. For a couple of reasons, and I'll tell you that it's not just happening locally. I mean, when we're on our having conversations with the governor's office, that is constantly being discussed, and I would say it's in the top tier of issues that we discuss as mayors as well, for a couple of reasons. I mean, one is the human side, which is these are individuals that are the most vulnerable in our community, with the least access to resources, without housing. They're exposed outdoors. So they're in a really critical state. So that's a huge part of it. The other piece is a very also practical piece, which is homeless individuals are some of the first to go to the emergency room, not just for COVID-related issues, but for any health-related issue, because they don't have access to medical care or insurance. And so if we're really going to keep our ER rooms and our hospitalizations low, then we've got to make sure that people experiencing homelessness have access to medical care and they're also being taken care of, because that is beneficial to not just them, but to the whole community. So it's a huge issue. Do we expect there to be more? Yes, we expect, I think all mayors, I speak for myself and I think for most, we have always expected there to be challenges within the population of people experiencing homelessness. We've seen now, obviously, we have our first case. I'm also heartened to know that as far as the investigative work on that one individual is turning out positive, but certainly we should expect and can expect that there will be others, and how we handle that will be really, really important. The governor has proposed, as you know, some significant dollars for cities that were already being sent to us to address homelessness. We're using some of those resources to get these additional shelters online, to get to partnerships with some of these local motels, and so that work will continue. I think your second question related to local control and the way we implement our safer at home order. I think that we don't have a timeline. I don't think anyone has a timeline that has a clear date. I think that it would be a mistake to just throw out a date where we think this is the day where we're going to reopen businesses. What we have is we've extended our stay-at-home order to a period of time where we think we need to reasonably continue to stay at home. And as we get closer to that date, we will make assessments if that date needs to move. And that's also what all other counties and cities are doing. What we do know is that we're going to have to start coming up with ideas now as it relates to how we do this. And so I think what the governor is looking for, and he's mentioned this, is sometimes the best ideas come from the cities and come from those of us putting our heads together and thinking this is the way we should move forward. And so we're in Long Beach, we're going to try to come up with the best ideas possible, the most innovative ways to physically distance and keep people safe, and then share those with our county partners who really are our regional planning partners, Mayor Garcia in Los Angeles, the county in LA, and then hopefully come up with a plan for us here at the county level, and then see how that impacts what happens in the Bay Area, in the Central Valley, in Sacramento, and San Diego, and other places, because we're all going to have variations of whatever the statewide guidelines are going to be.
Thank you, Mayor. There's one more question from the media, and then we'll have a question from social media. We have another question from Jeremiah from the Long Beach Post. Go ahead, Jeremiah.
Hi, guys. Thanks again for taking our questions. This is going back to a little bit something the mayor said about feeling prepared right now for where we're at. And I'm just curious, we've had so many resources, state and locally, being poured into increasing hospital capacity. And has any of that been used yet? For instance, at the convention center, we've had 100 beds go up. Is anybody actually using those beds? And are we still expecting this huge surge in hospitalizations locally, especially after, like Dr. Davis said, Monday, the infection rate might actually be slowing down?
So one is we have not used the convention center yet, but it's set up and ready to go. So that's really an overflow location. We have also at each of the Long Beach hospitals, so St. Mary's, Memorial, College, at those locations, the health department has worked to expand capacity with tents that are out, really expands their ability to do their work. The hospitals are using those right now for different reasons, and some could certainly move patients out there if they need to. Some are using them to do some screening work, and so they're being used in a variety of ways. But as far as have our hospitals reached a capacity point where we're out of rooms? That has not yet happened, and so that is a positive sign. However, we are planning we're planning for worst case scenario, which is what we should be doing, and we're not planning on what we hope will happen, and so we are increasing. We've already increased our capacity by 500 beds, and we're not stopping. We're continuing to look for resources to increase that capacity, because we don't exactly know what's going to happen in the next few weeks. As someone that was a teacher before I was mayor and looked at a lot of data, 1 week or 2 weeks worth of data is really not a lot, and that is really, we need to look at a lot more data to get a real clear picture of where we're going. And so I want to really make sure, and I know that the governor and other folks want to as well, really make sure that we have enough data to understand if the surge is going to happen and when it's going to happen. There are still a lot of scientists and experts out there that think that is still coming. And so we're preparing for that and doing everything we can to make sure that we're ready. But again, if months from now, we're being accused of overreacting to everything, then I'm happy to take that criticism, because we should be doing everything we can to prepare for the worst case scenario. And so I hope that that level of crisis doesn't happen. But we got to be ready. Dr. Davis, do you want to add to anything in there?
No, very well said.
Okay.
All right, well, that does it for the questions from our media. I have some questions here on social media, and an interesting observation that we're seeing, Mayor, is a lot of people are questioning about the distance that we have here on the panel and why we're not wearing masks. And we trying to explain to everybody that if they could see us here, that we're at least 6 to 8 feet apart, we're physically distancing. But the question here is a lot of questions about masks and the existing health order. Dr. Davis, can you please clarify the importance of masks and why the masks and when the masks as it relates to the health order and the physical distancing? That would be very helpful.
So thank you for the question. The most important thing is all of the things that we've been talking about up until this point. So when we're trying to prevent this virus and slow the transmission, it's physical distance, which is at least 6 feet away from each other. It's washing your hands, not touching your face, coughing into your elbow. I don't know, what am I missing? Stay at home when you're sick, and don't be around other sick people. Face coverings are just an additional tool in your tool belt, if you will, to prevent and slow the transmission of the virus. And what it's thought to help with is preventing your droplets from infecting other people. So sometimes you can be infected, but you don't have any symptoms yet, so you don't know it. And so what this face covering does is prevent your infected droplets from infecting other people when you're out in public. So that's when it's recommended that you wear it. So when you're going grocery shopping, when you're going to the pharmacy, so basically when you're out in public and you cannot do the 6 feet distancing. So say you're exercising and you're just running past people, you don't necessarily need to wear it for that. But whenever you're going out where you're not going to be able to maintain this 6 foot distance, then the recommendation is to do all those other things, but then add the face covering in addition to that.
And face coverings can be anything. I get asked this question also, and Dr. Davis is right. And the way I've kind of described it to folks is, if you go out and you're out when there's folk and you're going to be around in other people, you should wear a face covering. And certainly it's required when you go to businesses and when you go to and workers are now wearing them and all of that. But it could be a scarf. It could be I think I probably have mine here. It could be one that's made homemade. It could be one that when you purchase on the marketplace. We have an active marketplace, which you can go to shop.lbpost.com, which is one of our media partners that has one, where you can purchase them. But people should be wearing them when they go out. And I can share with you that even in this room, we have a few camera folks. Everyone's got their face covering on, as do we when we walk out this door. We have our face coverings on as well. And so those are important. I would encourage folks to wear them when they leave their house. They should have one. We know not everyone is complying. Will we ever get 100% compliance? I wish, but probably not. But if you want to protect yourself and your family and want to be protected, folks should wear face coverings.
Thank you very much, Mayor Garcia. That will do it for us on the questions. If you want to go ahead and pass it off, sir.
Thank you. And now we're going to do our Spanish translation. So muchas gracias. Ahora vamos a tener esto en español. So vamos a pasar esto a Alice del Departamento de Salud.
Hola, muy buenas tardes y gracias por estar con nosotros hoy. Desde hoy tenemos 379 residentes de Long Beach que han salido positivos del coronavirus. Desde nuestra última sesión informativa hemos perdido a 4 residentes más del coronavirus. Eso eleva el número de total de muertes a 18. Nuestros corazones están con todos los que están en duelo en este momento tan difícil. También con eso, desde hoy vimos nuestro primer caso de el individuo desamparado, o como se dice en inglés, homeless Y nomás he visto que hay mucho enfoque y muchas preguntas sobre eso. Le queremos recordar que en los lugares de desamparados que hemos puesto en los parques de la ciudad de Long Beach, no podemos forzar a nadie que esté desamparado ir a uno de estos lugares para autoaislarse. Nomás queremos que entiendan, porque han visto algunos reportajes de algunos dueños de alrededor de la ciudad, de sus negocios, que dicen que se están juntando varias personas desamparadas por esos lugares y en las calles, pero recordarles que no podemos forzar a nadie a ir a estos lugares de desamparo. Es todo, obviamente, especialmente si alguien que es desamparado está saludable y no está enfermo, no está infectado. Ellos deciden estar en la calle. Todos los parques y todos los sitios de desamparo no están a su capacidad. Tenemos más que suficiente espacio en ellos. Si conocen a alguien o saben de alguna familia o que viven en su auto y necesitan amparo, por favor, háganles saber que estos servicios están disponibles en nuestra ciudad. Seguimos también unos datos sobre el gobernador, que el gobernador Newsom de California ha dado órdenes y sabemos que estas restricciones no son fáciles y que tienen un impacto real en nuestra economía y en los presupuestos familiares individuales. Les recuerdo que no durarán por siempre, pero sabemos que lo de la economía es muy importante, pero la prioridad es todo lo que tenga que ver con la salud, primeramente. Necesitamos poder monitorear cerca y rastrear casos potenciales para prevenir la infección de individuos al alto riesgo. Por ahorita también tenemos, queremos garantizar que las escuelas, las empresas y las instalaciones de cuidado infantil puedan apoyar el distanciamiento físico. En una nueva orden también de salud para proteger a los adultos mayores. En este sentido, queremos informarles sobre un nuevo orden de salud que entró en vigencia hoy, el 15 de abril. Esta nueva orden de salud está diseñada para proteger aún más a los adultos mayores y aquellos con afecciones de salud subsiguientes que viven en centros de enfermería de atención de largo plazo. Como hemos visto, no nada más aquí en la ciudad de Long Beach, pero en todo el país, estas instalaciones tienen un alto riesgo de contraer infecciones del coronavirus y como tal es nuestra prioridad número 1 hacer todo lo posible para evitar que se produzcan infecciones y si las infecciones ocurren, detener a aquellos que propaguen entre los residentes y el personal que trabaja en estos centros. Este es un tema muy crítico y estamos haciendo todo lo posible para superar este desafío. Algunas de las acciones que tomó la alcaldía de Long Beach durante la junta anoche es que el abogado de la ciudad redactará una ordenanza de emergencia que requiere que los empleadores de Long Beach con más de 500 empleados brinden cobertura de días de enfermedad relacionada con el coronavirus. También los hoteles impactados o moteles, el plan crea un grupo de trabajo de recuperación de hospitalidad para desarrollar un plan que tenga estrategias para la recuperación de visitantes, el turismo, viajes de negocios, habitaciones y hospedaje en Long Beach. Ayudar a los titulares de hipotecas también es muy importante asociarse con organizaciones comunitarias para promover programas de protección de ejecuciones y hipotecarias estatales, federales y con todo lo que tenga que ver con sus pagos de sus casas, por ejemplo. Apoyar a los trabajadores de hospital y limpieza que han sido despedidos. De estas acciones importantes tomadas por nuestra alcaldía anoche ofrecen asistencia importante a todos los residentes y trabajadores en nuestra ciudad. Como decimos, esta es nuestra prioridad, continúa siendo nuestros adultos mayores. Los datos muestran que los adultos mayores, así como aquellos con afecciones de salud subsiguientes, tienen un mayor riesgo de desarrollar complicaciones graves del coronavirus. Esto es muy consistente con lo que hemos visto también a un nivel mundial. Durante la semana pasada hemos compartido con la ciudad y el Departamento de Salud han estado trabajando estrechamente con los centros de atención de enfermería a largo plazo durante muchos años para ayudar, monitorear y hacer cumplir los protocolos adecuados para prevenir la infección entre adultos mayores. Durante esta pandemia, el Departamento de Salud se ha comunicado regularmente con los 93 centros de atención de enfermería a largo plazo de la ciudad y ha trabajado en colaboración con los preventivos de infecciones del Departamento de Salud Pública de California para compartir las mejores prácticas que apoyan a los adultos mayores en Long Beach. El Departamento de Salud ha estado poniendo a disposición equipos de protección a los que lo necesitan. Sin embargo, hay más que podemos hacer para reducir la cantidad de casos nuevos del coronavirus. En pocas palabras, obviamente no es solo el distanciamiento físico, pero también en estos sitios vamos, con esta nueva orden, vamos a pedir requisitos adicionales. Por ejemplo, no se le va a permitir la entrada a cualquier persona, solo para esas personas que son esenciales. Cada vez que alguien entre, tienen que tener una cobertura facial. Y también los trabajadores. Es importante proteger a los trabajadores que están atendiendo a las personas que son pacientes en estos sitios. Todos los pacientes y los trabajadores y empleados tienen que tener coberturas también. Algunos van a tener, los que están enseñando síntomas, también van a tener que tener una mascarilla que es más, que se usan como para cirugía, especiales, las médicas también, especialmente si están teniendo síntomas del coronavirus. Un segundo requisito central a la atención que con los empleados, obviamente, los proveedores médicos y otros personales esenciales. Cualquier persona, como dijimos, que tiene fiebre o síntomas debe seguir esta orden de salud. Creo que eso es todo la información que tenemos por hoy. Muchas gracias por estar con nosotros hoy.
Y muchas gracias también por estar hoy día, y vamos a estar otra vez el viernes a las 3, and we'll be back at 3 p.m. on Friday for the next update. So thank you again.